In our Peri-Op 101 nurse development program, prepping is always one of our hot topics. We have so many new nurses coming into our departments and on-the-job trained nurses, and they do great. But when you ask them to elaborate on the why are you doing that? Or why are you doing that way? We really tend to hear that famous phrase, the one that tastes like vinegar coming out of your mouth. This is how we've always done it. Let me introduce you to At a Glance. To the right of the guidelines, At a Glance tab offers a drop-down. For all of those, what is it? How do I do it? Help me get started. So you can see I have a few here that have been saved. These are common ones that I am going into over and over again. But as an administrator, we have to deal with quite a bit of turnover. So when we get our new teammates, let's start off on the right foot and really give them the tools to feel competent as well as confident using those best practice guidelines. So this offers you not only at a glance tips, best practice guidelines, but as an OR nurse, I've seen an iPrep done in many ways. This gets diluted, that gets diluted. We're starting from the bottom to the top, or vice versa. But really, what is the correct way to do it? What does the evidence say? What are those best practice guidelines? And really, how are we as healthcare professionals promoting patient safety and guaranteeing that our patients leave better than they came in? So At a Glance not only offers that step-by-step visual instruction, but also explanations about the various prepping agents that we're going to use, talking about if a patient has a certain comorbidity, why we wouldn't use this product. So it really gives them a full picture of what this looks like in action. Also, the term IFU gets brought up a lot in our best practice guidelines. Instructions for use or manufacturer instructions for use are sometimes a foreign phrase to our teammates. So I think this is a fun way to also introduce that, get them in the know, have an educational opportunity where they get to look those things up because now they're hearing about it when they're reading it on AORN's platform for eGuidelines Plus.